Good evening, everyone. Welcome to today's program. And today we're talking about special need, understanding special needs and inclusion in the early years. There's been a lot of confusion. A lot of teachers don't want to handle special needs. They don't even understand what it means. And that's why we are doing this today. Our speaker is a specialist in early years and SEN, special educational needs. That's what she does. So I got her on board to be able to talk to us and shed more light because God knows I don't really know a lot about SEN, and even the little I know only for primary school. But me and early years, we are like, uh, should I say, fire and hot water? We are not too much in tandem. But I know that there are some things I really need to understand as an educator because some people have actually asked me some certain questions. So hoping that she will come here soon. She actually said she's ready. I don't know why she's not here. Uh, all right, so she said she's joining now. I think she lost track of time. So in any minute now, we will go on. But one of the reasons I decided to do this is because of the UN SDGs, especially when you have to talk with sorry, when you talk about education for all, quality education for all, and also inclusion. People throw these words around, but they really don't know what it means. So that's one of the reasons I'm doing that. One of the reasons why I said let's talk about this. Apart from the fact that teachers shy away from it, a lot of parents shy away from it. No, their children are not special needs. No, they don't understand a lot of things. And unfortunately, we think about special needs as autism. When you say your child is special needs, just say autism. And when you say that word, autism is very big, and people are confused. People say, no, my child is not autistic, my child is not this. But special needs cut across a lot of things. Why are children not understanding mathematics? What's the problem with children and spelling? Oh, what is the children with problem with shapes? It's a lot. And Miss Indianova is here, will be here shortly to tell us um, what all that we need to know about it. I hope she didn't say it's Nigerian time. Mm. All right. Hi, Miss Victory. Welcome for joining us. And our speaker is here, Indiana Von. Sorry, Indiana Von Dangaru, that's her name. And as I said earlier, she's a special needs educator focused on the early years. So she understands a lot of these things more than we do. So we'll be listening to her for the next few minutes for her to broaden our horizon, broaden our knowledge concerning this. Hello, Miss Indiana Vaughn. Good evening. Welcome. Please unmute your mic and you can have the floor. Unmute your mic. We can hear you. Yeah.
Good evening, all. Thank you for joining this session. In the next few minutes, I will be sharing my slides. Thank you.
All right. Mr. Abu, good evening. Well, thank you for joining.
Okay, can you all see my screen?
Um, Ms. Indianavon, we can't see the whole of your screen. It's showing just part of, for instance, you see what is, and then founder. Yes, we can see no.
How about now?
Still the same thing. What is, and then P, and then founder. Still
Um,
halfway. Maybe you shouldn't um share your screen. Mr. Enweliku, please mute your mic. Mr. Enweliku, please mute your mic. This is better. Yes, we can see your screen now.
all right. Good evening once again. My name is Indiana Von Dangaru. I am a special needs consultant. I have been working with children with special needs for the past 16 years. I have been practicing in Abuja, Lagos, and part of Kaduna State. Today, I will take you on a journey on exploring the importance of early intervention. Of course, early intervention starts from the early years, so that is where the topic connects with the early years setting. Now, let's look at early intervention. Early intervention helps improve and sometimes prevent developmental problems. It also helps to reduce the number of children retained in later grades, reduces educational costs due to fewer children needing special education services, and it helps to improve the quality of parents, the child, and the family relationship. So let me just explain what this means. When we look at early intervention basically begins in the early years setting. So what they are trying to say is that if a child is able to receive an intervention early enough, the child could go on to achieve most of the developmental milestones before the child even gets to the primary school, thereby reducing the whole lot of cost, the stress, the services that the child is meant to receive in the future. So what they are saying is that providing early intervention to children with special needs has a high tendency of making them to outgrow it before primary school. However, this depend on the condition, the category, and the severity of the special needs. Early childhood and special education are related services. is a state and federally mandated program for children. Of course, that is in the developed countries like the UK, USA, and Canada. And we are looking at children from ages 3 to 5 who meet state eligibility criteria because they are experiencing developmental delay. Now, because of the kind of structure and system they have in place, they are able to provide some of these services for children who are experiencing developmental delay. So one may ask, why developmental delay? If you look at some of the symptoms or characteristics of some of the special needs conditions that might be present in early years, and you are so familiar with the early years, that's in terms of the developmental milestones, those things that children are supposed to acquire between ages 0 to 5 or ages 0 to 6. Yes, then you agree with me that about 50% of these signs and symptoms are actually things that are exhibited in the childhood developmental pattern normally. So for example, it is very difficult for you to get a child of 3 years to just stay in one place for you for up to like 3 minutes or 4 minutes, right? In terms of look at their pencil grip is still developing. Some of them will struggle with food. Some of them will prefer when you feed them. You know, a whole lot of things. You see some of them up to ages 5, they are not potty trained and all that. So at what point does it become um at what point does it become worrisome to either us, the teachers, or to the parents? Now, when we notice that the child keeps growing with some of these milestones unachieved, right? Like tiptoeing. Tiptoeing is a sign of sensory dysfunction in children with special needs, particularly children with autism spectrum disorders. However, it is very normal for babies to tiptoe. You understand? Because in tiptoeing, they are just trying to explore the different styles. In fact, some of them actually do that just to feel the weight of their body on their toes. You
Okay.
understand? But however, it is expected that between ages 2 and 3, children are meant to stop tiptoeing. But somehow they continue to grow with that tiptoeing. I mean, we still have adults that tiptoe till today, and that doesn't mean that they have special needs. But if you look at it critically, you might see that. Sorry. If you look at it critically, you might see that they have a sensory need.
Okay.
Early intervention is the process of providing services, education, and support to young children who have or are deemed to have an established condition. It could be any of the special needs conditions. Children who are evaluated and deemed to have a diagnosed physical or mental condition with a high probability of resulting in a developmental delay. Children who have an existing delay or a child who is at risk of developing a delay or special needs that may affect their development or impede their education. Now, you are going to be hearing a lot of the developmental delay because this session is not tailored to any particular special needs condition. So if I
Okay.
say the developmental delay, just assume that it might be a special needs condition or it is a special needs condition. So we don't just see children who are experiencing some of these delays and say that they have special needs. No. Ideally, when a child is maybe 2 years and you notice that most of the milestones of a 1 year old are still not present in this child's life, you still need to give the child another 1 year. So what happens in the special needs setting is that if I assess a child of 2 years and I notice that he is showing some of the red flags, for example, autism. So let me look at the major one. Let's say the child is not talking. The child is 2 years, he's not talking, he's not babbling. He's just pre-verbal, or some people will say non-verbal, but we don't
Yeah.
use non-verbal because we don't know when the child will eventually talk. So we say pre-verbal. So let's say
Okay.
I assess a 2-year-old who is pre-verbal. In my assessment report, I'm going to also refer that in another 1 year, they should conduct the same assessment. So let's
Mm.
say after 1 year, that's by the time the child turns 3, and they conduct another assessment, and the child is still pre-verbal, that is when I can be able to make or point to the direction of, oh, it's either this child is having a developmental speech delay, or he might be on the spectrum. You understand? And
Okay.
this
Yeah.
is usually for children between 0 to 5 years. It's somehow difficult because when you meet some families, they are going to tell you, oh, my first son spoke after his 5 years birthday.
Yes. Yes.
So if you hear that, at least it should give you a hint that maybe in this particular family, they will usually experience a speech
Yes.
delay,
Speech.
because most of these things are genetics.
Okay.
They are hereditary. In fact, about 85% of the special needs conditions are hereditary. But because we cannot start saying, oh, honey, gather all your family people, let us ask them whose child was exhibiting this, or you too, you call your mother, you call your cousins, you call your siblings, even the ones that you don't know. You understand? So
Yeah.
yeah, it goes as far as that if you want to check if there's
That's
really a family history.
that's huge.
It is huge. It is. In fact, sometimes it might even fall like in 4 generations before the child was born. How
Wow.
can you trace that? Yes. How can you trace that? So just the way some of the genes are recessive, some of the genes are dominant in a particular generation, it is the
Mhm.
same thing with the disability trait.
Wow.
You cannot say that this trait come and appear in this generation, you go back. You understand? I'll
Mhm.
give you a typical example. So some families, let's say they are all black,
Yeah.
like very very dark, the African dark color,
Yeah.
and then all of a sudden this brother marries, and then the wife now gives birth to a very fair
Albino.
child,
Or even albino.
or even albino. Albino is even explanatory, because if you look at the causes of albino, you will know that it is because of our skin color. That's the
Yeah.
albinism and all that. Yes, that one is
That's for
even,
you
you
people
can even
that
relate.
know it. For us that are novices in this area, of course we don't know
Yeah.
that. I'm just hearing this
Okay.
now.
Oh, really?
Yes.
Okay, so what happens? Okay, let me explain this, and then I'll come back to just explain albinism, just for the purpose of this training. So
Okay.
so let's say the wife delivers a very fair child
Yeah.
that is not albino.
Yes.
You begin to hear things like, ah, are you sure this is our son? Are
Uh-huh.
you sure this is this? Are you sure this is this? So in the midst of all this confusion, One aunty will just visit from the village and she will tell you, yes, their great grandfather was very fair.
Mm.
This
Yeah.
one, that one, this one, that one. You
Mm.
understand?
Mhm.
So gradually you begin to gain understanding that, oh, okay, so that means there's even the gene of fairness in our family.
Mm.
So if you hear something like that, uh you will now be much calmer that, okay, yes, this is truly your blood.
Yes.
But if there was nobody in that generation that knew that great grandfather was fair,
Mm.
I bet you is that is going to cause a serious rift.
Yes.
Yeah, so that is it. So coming back to albinism, it is also hereditary. Of course, we already know the characteristics:
Mhm.
light skin, hair, and eyes.
Mm.
So usually, black people, we have melanin in our body.
Mhm.
So melanin is responsible for maintaining our black color, abi our blackness. I don't know the word I will say, but our black complexion. However, sometimes there might be a very low production of that melanin component during the
Okay.
conception of a particular pregnancy.
Okay.
And because of the low production, the child will not come out dark skin.
Dark skin.
The
Ah.
child will not come out with a condition called albinism.
Mm.
That's why if you check, you will see that albinism is more in the black skin.
Yeah.
Yes, so that's just sorry for diverting. I just wanted to
No, thank you for the
indicate a little
clarification.
on that. Yes, yes. So let's go on. Early intervention is about taking action as soon as possible to tackle problems for children and families before they become more difficult to reverse.
Mhm.
Early intervention involves identifying children and families that may be at risk of running into difficulties and providing timely and effective support. Early intervention is about enhancing the capabilities of every parent to provide a supportive and enriching environment for their children to grow up in. Then the next generation has the best chance. Oh, I can't see this very well. Okay, to engage in the skills. Okay, so now basically this is just explaining the importance of early intervention. Like I already said, I usually don't like to talk.
Pardon?
More civilized country like the USA, they have
Okay.
something called IDEA. Is a government agency. IDEA
Okay.
stands for Individuals with Disability Education Act. So
Mm.
there, because of the kind of system they have, they are able to diagnose children as early as age 1. And the reason for that assessment is for them to be able to know the kind of intervention program that they will provide for the child. So it is usually free. The parents do not pay. It is the government that takes care of that. That's why
Mm.
you easily see abroad, you see most of the parents resigning from their job just to take care of their children. They are being paid.
Mm. Wow.
Yes, because they are doing the services that a government worker would have been providing. So
Mm.
usually some of them have the ones that either come to the house to provide therapy for the child, or
Mm.
they have the school. So whichever school that the child is attending, the child doesn't pay school fees. It's the government that pays the school fees for the child.
Okay.
I pray that it will come to Nigeria very soon.
Amen. No.
Okay, so let's look at some of the services available in the early intervention setting. So of course, most of us are familiar with the early years setting, that
Mm-hmm.
we always focus on child. So it's child focused center based program.
Yes.
So this type of program works directly with young children to help improve chances for positive development outcomes and successes in school. Some programs also include parenting groups or home visits to help enhance positive interactions with their children. Child focused center based programs provide special emphasis on providing activities to enhance developmental skills, for example, cognitive, fine and gross motor, language, social adaptive skills. So let me just explain this for clarity's sake. When we talk about when we talk about cognitive, we are talking about those activities that is going to build the child's critical thinking and problem solving skills. When we talk about fine and gross motor, fine motor has to do with smaller muscles of the fingers or smaller muscles of the hands, while gross motor has to do with larger muscles of the body and the legs. So you might encounter children in the early years setting who are unable to write because they do not have a good fine motor coordination. So what do? You provide therapy for that. We have therapy for all these things. For gross motor, we also provide therapy for the gross motor. However, for the gross motor muscles, we also check the intensity. If it is severely bad, then you will know that it's not just an occupational therapist that will work with the child. You will
Yeah.
definitely need to include a physiotherapist in the team,
Okay.
like in our space in little me preschool, we
Mm.
have a physiotherapist that also
Mm.
provides physio for the children who have cerebral palsy and poor motor coordination. So
Okay.
depending on the severity of the child's condition, you design the program to suit the child's needs, so that the child will not be under receiving the program. But
Mm.
of course, in Nigeria, it is being paid for.
Yeah.
We are still fighting to see how government will be involved, but more like they are focused on the international international whatever of the of persons with disability. That's the one that they are more focused on, but
Mm.
they don't know that there are other developmental delays that
Yeah.
has to do with all these cognitive, fine and gross motor, language and social skills and all that. They are not aware. They are just focused on that disability, physical disability aspect. So in terms of language, language is three now. It's usually speech, language and communication.
Okay.
Looking at the early years setting, I know that we try to explore different different skills for them to build a good foundation for phonics or phonetics. That is where speech comes in. So speech sounds, the individual sounds of the alphabet. That's the basic. So if you have some children who are unable to even pronounce the sounds of each alphabet, that can be a red flag for
Hmm.
either a language or speech delay.
Wow.
So after acquiring the speech sound, the next thing is they move to blending these speech sounds to form words.
Yeah.
If they are able to build the words, they move to language. They use these words in expressing language during communication. So step by step, some children can identify speech sounds, some children can blend words, but they cannot talk.
Hmm.
Do you understand? Yes.
Yeah.
So when it comes to language, we look at two things: expressive language and receptive language. So most children have a very good receptive language skills. So what is receptive language skills? Receptive, you tell a child sit down, the child obeys. That means the child has received your instruction. You send the child on errands, the child is able to go. So most of these things occur without the child not necessarily verbalizing anything to either say yes or no. You just give the child an instruction and the child follows. Now, in cases where the child does not follow instructions, we still record it to see how often. So if the child continuously to disobey or he's unable to follow instructions, maybe because he has a very low processing disorder, or maybe he does not even understand the command,
Hmm.
we also record. That is another red flag for a disability. Now coming to expressive language, as the word implies, is this child able to express himself? Excuse me, I want to wee, I'm hungry, I want to sleep, I'm tired, I want
Hmm.
this, I want that. How often is the child even expressive? Because there are some children that will say a word once a month.
Hmm.
It is also a red flag for a language or autism spectrum disorder. So being in the early years setting, you really have to be very intentional to watch out for each child at a time. It's not in group. When it
Hmm.
comes to early years, it's one child at a time, because that is the only way that you can be able to monitor the child's development pattern. Then the third one in this category is communication. Some children have language, but they don't know how to communicate. They don't know, like, they cannot initiate a conversation. Some cannot initiate conversation and they cannot give you a feedback, while some,
Yeah.
they can only speak with you when you ask them something. Like, they can't just see you and greet. Until you greet
Hmm.
them, you now ask them how are you, they will say fine, that's all, and it stops there. They won't even engage you in another uh, conversation or something. So these are things that we all need to pay attention to in the children that we work with in the early
Hmm.
years setting,
Honestly.
because
Hmm.
it's very, very important. Looking at social skills now, on the social skills, you check, does this child loves to play with his peers, or the child loves to play alone? Does the child loves to share their toy and all that? So you check all these things. It becomes a concern when the child continuously to segregate himself from peers, because you know that normally, that's in the normal setting, children
Mm.
love to play with each other.
Yeah.
In fact, children are more social than adults, because as an adult, you see, okay, what if I talk to her and she does not even respond? Look at her face, she's not even smiling. Ah, this one, but children, they just go and warm up to each other. You understand? They
Yeah.
don't they don't think about all these things, whether you are rich, look at the kind of clothes you are wearing. Children
Mm.
don't do all those assessment. They just play. Like, look at imagine children in a playground. They all came with their parents. They met there. Some of them will live there making friends.
Yes.
In fact, most times in parties, it is actually children that make their parents connect with each other.
Yes.
um So you check, if the child is not social, it is a red flag for something. Or study the child. Maybe the child is hungry, he cannot express himself, or the child did not get enough sleep, he wants to sleep and all that. So that's why I say, when it comes to early years setting, we really need to take one child at a time, because that is the only way that we can be able to understand the children that we work with. Now, last one, adaptive skills. So look at adaptation now. Under adaptation, we will look at activities of daily living. I know that most of the children, is not their fault. Some of them have 5 nannies attending to them, so they don't know how to button their shirts, they don't know how to lace their shoe, they don't even know how to remove their clothes and all that. They don't know how to pant down when they want to wee or something. Instead, they will just pee on themselves and all that. So we look at all these things, combing of hair. So basically, activities of daily living implies things that we do every day. So let's mention them: brushing of teeth, combing of hair, dressing and undressing, using the restroom, washing hands before or after, before or after a meal, and all that. So we need to also check all these things. Even check, can the child feed him or herself.
Mm.
So sometimes, when you see some of these lapses or developmental delay, it is actually good to communicate with the parents, because some of the parents, we end up encouraging them to allow the children to do most of these things by themselves. But they
Yes.
will tell you, oh, I'm rushing, I don't want to be late. So the nanny
Mm.
will always dress him, because the nanny will do it faster, so they can save time. So you can encourage them, even if it's just weekends, they should be able to add that program to the child's activity, just to encourage the child, or to even teach the child responsibility and all that. So we have short-term and long-term improvement associated with this program, and I've found for children who participate in this type of early years service. So actually, depending on the kind of need that the child wants, usually after assessment, we design something called individualized education program, where we capture short and long term goals, and then we also give a timeline for review and all that. Okay, next we have child and parent focused home visiting program. I've earlier explained this. So an an early intervention program that is provided through home visiting for infants and biological and non-biological risk factors to help improve outcomes. This type of program provides support to families by means of speech therapy, occupational therapy, physical therapy, and so on, and teaches parents medical interventions that might be needed for their children. This type of intervention is family focused, and needs are emphasized by the family and helping parents become the main interventionist for their young children. So this is the one that I said that most of the parents, they get trained while they provide the intervention program for their own children. Next, multi-system interventions with very high risk families. So of course, it is only after assessment that you can be able to know which one is low risk and which one is high risk. So we provide intervention based on the risk factor involved. So it is typically used with multi-risk families with complex intergenerational problems, multiple risks, and young children. This type of intervention uses a combination of interventions such as family therapy, parent training, supportive program, social skills training, case management, and advocacy. So you might even encounter some families that the child has special needs, and even the parents also have needs. So which means you have to provide support to both the child and the family, so that they can be able to support the child both physically and emotionally. Okay, so let's look at this developmental delay checklist. Please, can you read for me the first slide? Are you there?
Sorry, my mic was off. Okay.
Okay.
At 12 months, check if your child claps hands when asked to, pushes through. I'm sorry, I can't really see.
Okay.
Okay. When your phone was the other way, were you seeing properly? Maybe you can just read through from your side. Slant your phone, maybe
Okay.
you can
So
read it properly, even if we
okay.
can't see. Maybe at
Okay.
the end of it,
Sorry
you
about
can
that.
send the slide to me. It's for anyone that wants, if that's okay with you.
It's all right.
Okay. But you can slant your phone so you can see it properly.
Okay. So under developmental delay checklist, at 12 months, we check if the child can clap his hands when he's asked to. Of course, 12 months is 1 year. Pushes arm through a sleeve while dressing, that is assisting with dressing. So if you are wearing a shirt for the child, does the child even makes an effort to put his hands through, or he just allows you to see carry the hand and put it through the sleeve? We check all these things. Picks a small object using pincer grip, so that's the thumb and the index finger, right? These
Yeah.
two. Then put a toy put a toy down and then takes hands off it. At 18 months, check if your child says 8 or more words, says 2 to 3 words representing different ideas, walks downstairs with assistance. So these are some of the few developmental delays that are physical that you can be able to assess in your own setting to see. Now
Okay.
let's look at this other chart. I'm going to focus on the fundamental level. So look at this different position that children rule.
Mm.
So this
Okay.
is this is this is this is a good level. This is a good this is how children are meant to play. That's why we also encourage tummy time for babies,
Mm.
so that they can be able to build their core muscles. Looking at transitional level, of course, you see. So some children do not crawl, they just start walking.
Yes.
It's still not bad because that is their own pattern.
Okay.
However, if the child constantly falls while walking for a long time, then it will now become a cause to worry. Why didn't he crawl? Because truly in crawling, they also build a better gross motor skills. You understand?
Mm.
Then check functional level. When they can be able to maintain a good gait, they can pose for picture, they
Okay.
can walk in a particular way, you know. So but when the child is up to, let's say the child is up to 2 years, and the child does not have that neck control, it is a red flag. It is a red flag. So let's look at some of the causes of some developmental delays. Let me check my time. Wow, it's almost to 7. So let's look at some of the developmental delays, some of the causes, you know. Aha. Developmental delay can have many different causes, such as genetic causes.
Yeah.
For example, Down syndrome, or complications of pregnancy and birth, like prematurity or infections. Often, however, the specific cause is unknown. Some causes can be easily reversed if caught early enough, such as hearing loss from chronic ear infections or
Mm.
lead poisoning. Now, I'm sure most of us must have heard about Down syndrome,
Yes.
and one parent asked me, and one of my mentees too asked me, I think about 2 years ago. She said, why is it that a child with Down syndrome from China and a child with Down syndrome from Nigeria, why is that they all look the same?
Ah.
So yes, and I told her yes, they look the same because it is a particular chromosome that causes that impairment, thereby giving them that particular feature. So let's look at wow, wow, okay, we're almost done. So let's look at Down syndrome now. Down syndrome is caused by an extra pair of chromosome 21. Someone will say, what is chromosome 21?
Wanted to say you're just speaking Latin now.
Okay, so most of you that were biology students, you recall that each parent is supposed to contribute how many chromosomes? Let me see my good biology students. If you want to
23.
answer, you can.
One.
23. Fantastic. Thank you. So each parent is supposed to contribute 23 chromosomes. Now, these chromosomes are also your genes. I hope you know.
Yes.
Chromosomes are genetic materials representing the makeup of either the father or the mother. Now, these 23 chromosomes from each parent come together to form 46 chromosomes, right?
Yes.
So a fetus now is supposed to have 46 chromosomes in his or her body while growing in the mother's womb. However, when you go down your cell division, mitosis and meiosis, like I said, I'm taking you back to biology.
Mm.
Your mitosis and meiosis, look at those anaphase, interphase, whichever phase. You recall, you will see the pairing. You will see that chromosome 1 from mother, chromosome 1 from father, they join together. So that joining forms a particular thing. So let me just give an example. Chromosome 21 is responsible for, is just an example I'm giving you now.
Yes.
Chromosome 21 might be responsible for uh um
Height.
eye color. Just example.
Yeah.
Let's say eye color, um shape of face. Thank you for muting. Shape of face and all that. Now the body is not supposed to overproduce. The body is supposed to just produce one.
Hmm.
But somehow, because of some genetic conditions that we cannot explain, because truly we don't know, we are just working on what research has revealed to us. You now see that chromosome 21 now had extra pair like twins.
Hmm.
Instead of producing just one strand,
One each.
it now produced two.
Wow.
Now that two comes with a lot of challenges, like delayed developmental delayed speech, learning disability, short stature, this lazy eye that people call it. You know this
Yes.
lazy eye.
Yes.
It comes with congenital heart diseases, excess skin on the back of the neck, hearing loss, hypotonia, immune deficiency, low set ears, mouth breathing. Some of them don't breathe through the nose, so mouth
Hmm.
breathing, obesity, obstructive sleep apnea, and so on, even vision and thyroid disease.
Wow.
Yes. So these are some of the conditions that extra pair of chromosome 21 causes, that leads to the condition called Down syndrome. So their major features are, you see that the nose is flat. They have a flat nose bridge. This place where your nose is very close to your eyes, their
Yes.
own is usually flat.
Very fat. Yeah.
And slanted eyes that point upwards. The neck
Mm.
is short. Even the ears, the hands and feet, they are short. And then they may have a very weak fine and gross motor coordination. So that is why when you see a Down syndrome child that is Chinese and the one that is American, or the one that is Kenyan, or the one that is from Nigeria, they look the same.
Mm.
So it is the extra pair of this chromosome 21 that makes it look so. However, it is the only condition that can be able to be diagnosed when the woman is pregnant.
Wow.
Yes, it is the only condition that can be able to be diagnosed. So because it has to do with genetic, it is more of a genetic disorder. The amniotic fluid of a woman, of
Mm.
course, where the child is breathing, also contains the child's DNA, or it contains the child's chromosomes or genetic history.
Yes.
So what they do is they have a test called amniocentesis, a process whereby they get, I'm not a doctor, I don't know if it's injection. I don't know how they used to get a sample of the amniotic fluid, but mostly it's through controlled ultrasound. They use injection to get that fluid. So
Okay.
once they get that fluid, they now test that amniotic fluid to check if there is a condition of extra chromosome. However, if that needle mistakenly touch the hair
Hey.
or the skin of this fetus, it can lead to a serious condition. In fact, it can even cause this spinal bifida, this thing that damages the spinal cord.
Yeah.
So you
Wow.
can see yes, so you can see some of the risks involved. However, I think gradually they are beginning to explore more
Other.
testing, because I think in some countries they can get you through the woman's blood. So they said that at a particular month, that it can be seen in the mother's blood, that is while she's pregnant.
Yes.
But of course, now, none of this is done in Nigeria. Oh, we are still backwards.
Soon.
Amen. That is our prayer. You understand? So
Mm.
that is it about Down syndrome. Well, another thing is prematurity. So prematurity occurs from 26 weeks. Pregnancy is supposed to last for 40 weeks. However, any delivery between 37, 38, 39 weeks is still safe. But somehow some babies push themselves out at that 26 or 30 or even 28 weeks. So what happens is that by that time, most of their vital organs have not properly developed. So because the organs have not properly developed and the child is born, some of them, they might be placed in incubator for up to 2 months, depending on the kind of conditions that the child is presenting, because truly most of the premature cases usually come with some birth defects, while some come with nothing. Some of them, once they place them in that incubator and all that, after some months they are very okay. So this is another causes of developmental delay, prematurity. So most times you see that they support the child with some medication that can be able to help with the growth of those organs that were not properly developed. So what should I do if I suspect my child has a developmental delay? If you have concerns, act now. If you think your child may be delayed, you should take them to their primary care provider or to a developmental and behavioral pediatrician or pediatric neurologist. In Nigeria, you can bring them to me. I'm a licensed assessor. I can be able to assess and give a proper diagnosis on what might be wrong with the child, most especially if the child is above 2 years. What can the school system do for my child? So ask your school system in writing for an evaluation of your child. Even if your child is a baby, toddler or a preschooler, they are required to provide it at no cost to you. The purpose of an evaluation is to find out what your child is not meeting their developmental milestones or not doing well in school. So a team of professionals will work with you to evaluate your child. If you do not find any problem, you can ask the school system to pay for an independent educational evaluation like what I do. So of course, it is very important as teachers to be able to study these children, as I earlier said. So it is one child at a time, because by the time the parents come and start asking you question, okay, does my child plays with his peers? When you are teaching sounds, does he imitate? Does he do this? And you now say you don't know. Hey God, you know that that parent is going to get angry. It will be as if they are just paying school fees for nothing. So most times, in fact in most cases, it is teachers that even raise that alarm to the parents. Some parents don't even know how their children are developing, because it's either they are so busy with work, or some of them will tell you that they are not psychologists, and truly you don't blame them. So you as a teacher, if you notice that a child is experiencing delay, speak with your line manager, speak with your head of school. If your school does not have a special needs department, then you can be able to say, okay, I know someone, I know Mrs. Indiana Vaughn, she can be able to conduct assessment and tell you what is wrong with the child, other than keeping quiet. As you're keeping quiet, time is going for that child. You don't know if the child started intervention early enough. You don't know the progress that the child would have made. You understand? So I understand that we might encounter some parents that are living in denial. I bet you we have convinced the worst of them. At first they will be telling you, no, God forbid. In fact, I assessed one child. The both parents are doctors. So the dad is a neurologist, the mother is a gynecologist. So a neurologist, the man even does surgery on brain,
Hmm.
you know. So during the assessment, I think that was the longest session I ever had. I had done assessment of the child for 3 hours. When the parent came, I was explaining to them for more than 2 hours.
Mhm.
So it was much later that we all came to a conclusion that they agreed with what I'm saying, because for some parents you have to prove, you have to prove your point. You
Yes.
cannot just say because the child is, no, 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 you have to explain. You have to explain and explain. So it's very okay for you to even encounter parents that when you suggest that, oh, I think since your child is 3 years, she's not talking, I don't know, I'm just suggesting maybe you might want to take her for a psychological assessment just for us to check and all that, So there's no harm in trying. That's what I always tell teachers.
Yes.
See, some of those parents, at first, when you speak with them, they will get angry. They will remove the child from the school. The school will now be angry at you for making them lose a client. You understand? But
Yeah.
much later, we encounter them, and they tell us, they will
Mm.
tell us that the child's teacher in preschool was saying something, something, something like this.
Like this.
But you understand? Yes, I'm telling you, some of the parents, they will confess it because they are now looking for help. Maybe
Yes.
that by this time the child is already 5, the child is already 7, the child is already 10. You know.
Mm.
So please, let's all serve as advocates, because I always tell parents that it is not about you. It's not about you. You have lived your life. You have achieved what you want to achieve. But it's
Yes.
about this child. It's about this child. Let's work on giving the child the proper intervention that the child needs. So that is what school can do. That is what you as an individual can do. Referrals are very, very important. Even the regular hospital, some parents don't know that it is important to just do a general medical checkup. Some of them will wait until that child fall sick.
Mm.
You understand? So we have to change our belief system, our mindset, because this thing is a thing of Africa. We don't want to go to hospital until the child is critically ill. It's not good.
Until the body
So
is hot.
exactly, So let's look at some of the tips. I think this is our last three slides. Tips for your child's developmental assessment. So from 0 to 3 years old is a guide for parents who are concerned about their babies or toddlers development and learning. It will help you prepare for an evaluation and know what to do. So early intervention is very, very important, because you are in the early years setting, we are in the early years setting. It is, in fact, we assess more children in the early years setting more than the primary.
Mm.
and that is because we are intentional. It's
Yeah.
not easy. Some of the parents will tell you that the child is still growing. Allow the child to be 3 years. I'll not say anything. No, by that 3 years they will still come.
Mm.
They will be running outside screaming, stop. Me, I will still tell you, but I told you when he was 2 years. I will tell you so that you will know that I had more concern for your child more than your own concern of maybe labeling
Mm.
or any form of stigmatization that
Mm.
you
Mm.
that you think you might receive from your family or something. So I always tell them that it is always about the child. So what happens as my child grows up and eventually becomes an adult? Transition planning is a planning to get your child ready to lead a rewarding life as an adult. As the child gets closer to childhood, they will need an IEP transition plan, of course. So looking at this transition plan, for some of the children, their transition plan might be skill acquisition.
Sorry, we can't hear you.
Skill acquisition, skill
Okay.
acquisition or vocational training. Because sometimes some children may have a serious condition that they may not be able to learn, let me just call it as the African man will say, they may not be able to learn book, because we tend to focus more on academics. I want my child to get A's, I want my child to get B's, forgetting the child as an adult.
Mm.
So looking into the future, knowing that this child has this kind of disability, what should I plan for the child? So that is where that vocation comes, or skill acquisition. We explore several ways to see aspect that the child is able to build his interests, and then build on that to be able to give the child a skill so that he can be able to make a living out of it. However, this still depends on the condition, because we have a lot of conditions that, if they are being managed properly from preschool up to primary, they tend to do well. They tend to develop a lot of coping skills that they can be able to function as if they don't have special needs, but they have special needs,
Yeah.
because most of the special needs conditions are lifelong conditions, except if it was just a developmental delay. And most developmental delay are likely to disappear between 3 to 7 years if the child begins receiving therapy early enough. You understand?
Yeah.
So some see the disabilities, but the special education teachers see the possibility. Christabel, madam, you are. Okay, yeah. So I've come to the end of my training. I'll just go back to my first slide. I have a lot of information on my YouTube channel, and then I'll be here for question and answer. Thank you so much.
Thank you, Mrs. Genavon. I
You're
have
welcome.
a lot, lot of questions. I've written like I've just been jotting like one as if I have exams tomorrow.
Wonderful.
Um, First of all, before I ask the main question, are there other um 10 names or programs that we should know? Like you're talking about Down syndrome and autism, but I think I know it's as broad. There are other names from it for it. Like you keep hearing the name dyslexia. Don't know what it means. Some of us don't know what it means, you know. So are there
Okay.
other names? Are just maybe just a name and then a general what it stands for? You don't have to go in depth, just so that we are aware, because most of us here are educators. Most of us also there are also parents here. So in case we can be able to say, okay, my child has this. Because for instance, I have 3 children. From all your explanation, my children don't have Down syndrome. They don't have autism. But what if? you
All
know.
right.
Uh,
Okay, so I'm going to focus because they are a whole lot. I don't want to take much of our time. So I'm going to just I'll be mentioning the most common ones anyway.
yes. Okay.
So I've already explained Down syndrome, right? That's one.
Yes. Uh-huh.
So the second one is autism spectrum disorders. So autism spectrum disorders is characterized by three or four major traits that you see in children. Number one is poor social skills. Number two is repetitive behaviors. Number three is delayed speech or language development.
Okay.
Then number four is sensory dysfunction. Sensory dysfunction in the aspect that when a loud sound is being played, you see a child with autism closing his ears because the sounds
Yeah.
are too loud for him, or
Yeah.
sometimes you see them selecting food of different textures.
Mm.
Some of them they have oral defensiveness. Oral has to do with the mouth, so it's very difficult for you to brush them, is like that. Then yeah, under repetitive behaviors, you can see some of them flapping their hands. Some of them are very rigid to their routines. Once you change their routines, it becomes a problem and all that. And then autism spectrum disorder mostly comes with a comorbid condition. Comorbid means it can occur more than two. So you see a child with autism spectrum disorder also having learning difficulty. So that leads me to specific learning difficulties. So specific learning difficulties is a hidden disability because it doesn't have any behavior manifestation or any physical whatever. It has to do with reading and writing. So we have three major specific learning difficulties. The first one is dyslexia. It has to do with inability to read, write and comprehend. Number two of the specific learning difficulties is dyscalculia. Please, if I'm speaking too fast, let me know.
It's okay. It's okay.
So the second is dyscalculia. Now dyscalculia has to do with the inability to manipulate arithmetic calculations or to solve word problems and all that. Even summarization of memorization of the multiplication table, they find it very difficult to do. And even if you check some adult, even some of you here, if I say, oh yeah, come and say 9 times table,
I
you are
can't
going
do.
to solve
Number one, like.
it. So you see a lot of adults saying, I don't like maths, I don't like maths. We
Mm.
need to come and assess all of you, you understand,
Come
to
on,
see
set
whether
me.
you have dyscalculia. So the third one is dysgraphia. Dysgraphia from graph.
Okay.
Dysgraphia. So dysgraphia is a written expression disorder. So for example, the child has the ability to hear. He hears, understands what you say, but if you ask the child to put it into writing, the
Mm.
child finds it very difficult to put it into writing because he cannot even compose what to write.
Mm.
Is that bad? And this one, you have a lot of them in your classrooms,
Yes,
but most of you don't know.
there's a particular child I'm remembering now. If I call one of my former colleagues, if I call the child's name, he will remember. He will know the child. I had that issue with, and I tried to tell the mother that she had this problem, and we had issue and everything, but we sorted it out. But I told her she should try and get a therapist. As if I knew, I just didn't know the name, but I knew that there was something about this child.
So
Yeah.
dyslexia, dyscalculia, dysgraphia are actually common in the regular school setting. So
Mm.
sometimes even you as a teacher, you begin you begin to question your capability as a teacher. Is it that I'm not teaching this child well, abi what is wrong? You understand? So It is not as a result of bad teaching.
Mm.
It's just the child's brain, and it is a neurological disorder. It has to do with the brain. So for example, if you scan the brain of a child with dyslexia and a neurotypical child, you are going to see the differences. So you know that in the brain there are, let me not go into that. It's another this thing. So
Okay.
we have speech or language impairment. So oftentimes assessors get confused with autism spectrum disorders and speech language impairment or speech disorder. So remember, under the characteristics of autism spectrum disorders, I highlighted delayed language, right? Either
Yes.
delayed language, echolalia, or absence of language. So
Mm.
echolalia is simply if you meet a child and you say how are you, the child will tell you how are you. That's echolalia. The child just echoes what you say. It is a red flag for autism spectrum disorder. So most times people can have a confusion as to whether it is a speech delay or it is autism spectrum disorder. We also have language delays. So under language delays, we look at articulation disorders, stammering, stuttering, and all that. They are all disorders. Then we have attention deficit hyperactivity disorder. I'm sure most of you are familiar with this one because when you see that a child is hyper, you will say it's like this child has ADHD, you know. So we also have hearing impairment. We have developmental delays on its own. So the developmental delays occur when a child is not meeting up with the developmental milestones like walking, talking, and other things. Let me see. Oh, we have a lot of conditions, but I think I've mentioned the most common ones. We also have we also have OCD. So OCD is obsessive compulsive disorder. Yeah, it is characterized by repetitive behaviors, like having excessive thoughts and all that. But it can be treated. It can be treated, and the child will be able to sort of outgrow. So we even have some adults that have OCD. Yes, we have adults that have OCD. Then we have physical disability. Physical disability can come in different form. Some of them, they cannot walk without assistance. Some of them can walk, but maybe they might be limping or something. So
Mm.
I think we've captured some, right?
Yes. About
Uh-huh.
11 altogether.
Aha.
Everything.
Oh, you were counting. That's good.
I told you I've been jotting like I have exams.
So we have a lot of them. Perhaps another session we might
Yes.
just look at the conditions and what they are. You understand? Because it is truly a lot. It is a
Mm.
lot. There's one common one, sef. What is it called? Um, Global developmental delay.
The answer is global again.
Yes. So it occur when a child is not reaching certain developmental milestones of
Mm.
his age. let's look at some of the symptoms. So you have conditions begin during developmental period, when the child is learning how to crawl or wave, or that's to say bye.
Mm,
Difficulty with overall communication and socialization, delay with cognitive skills, speech and language skills, fine and gross motor skills, social and emotional skills, and daily activities. And it is usually a lifelong condition. So this is one of the recent conditions that have been found. However, if you look at global developmental delay and autism spectrum disorders, you are going to see that they are closely related.
yes.
So most times you see some autism children receiving diagnosis to have either autism and developmental delay or just global developmental delay. So all this one is just name that they want to give it.
Okay.
Yes.
Thank you. Can I ask another question? Since nobody wants to
Yes.
ask a question, I'm the only one here. Um,
Okay.
okay, so are there trainings that, for instance, is there a training that I as a teacher can do just to maybe identify or understand? Is there a particular course training I can do as a teacher? I don't want to be a therapist.
Yes.
I just want to be able to identify it so that I can
Yes.
only
There
advise.
are Yes, I provide such trainings. We
Oh,
have short courses. We have short courses of 1 week, 1 month,
okay.
depending. And most of the courses are tailored made. So we
Oh,
design it based on your needs and what you want to focus in.
okay. So,
Yes.
are they physical or online?
If you are in Abuja, we can do physical. If you are not in Abuja, we can do virtual. If you are in Abuja and you are busy because of work, we still
Mm,
offer virtual.
okay. Wow, that's
Yes.
nice. Okay, and
Thank
last question. Last question. Don't say I'm
Okay.
taking all your time, please. Sorry. Last question. Now, as a teacher, uh, how can I help uh, parents or even therapists in my class, for instance, because I've been able to teach. I know that some schools invite therapists with children in the class. How can I help the therapists? How can I help um, the parents also so that I can create an inclusive atmosphere in the classroom for that child? How can I do that?
Okay. Now
You are still sharing your screen. We are seeing everything on your screen.
I want to come back to the meat. Oh, where is the meat now? Now, partnership. Partnership is very, very important. You understand? It is very, very important. So, you can start by discussing with discuss discussing with the therapist to
Okay.
know what they are doing. You can also ask the therapist about the
Your mic is off.
uh-huh.
Okay. Thank you.
All right, so I think I need to come here. How do I stop screen sharing?
You said
I want to stop sharing my screen.
uh, you had gone off where you were before. This is a new.
Okay, so let's continue.
Okay.
So you can start by asking them to share the child's IEP with you. That's
Okay.
individualized education
Plan.
program. It will be able to help you to have a detailed understanding of the child's condition. So from there, you can be able to help.
Okay.
Yes.
Okay. Wow. I I have learned a lot today. Thank you, Mrs. Jennifer. I've learned a lot today. In fact, it's it's super. Thank you very much. Does anyone have any other have question rather? Does anyone have question?
Yes, I do. Good
Okay,
evening.
please. Good evening, Miss Chiso.
Um, Thank you very much, Indianovo. My question is, so what I know that the teachers have a role they play in, figuring out that the child has a developmental delay. How, for parents who are quite busy, like you said, you go to work, you come back, you probably barely have time for yourself. What are the things you're supposed to look out for? What do you look out for to know that there is an issue? And at what point do
For
you seek
parents.
for? Thank you.
Miss Gray, is that as a parent or as a teacher?
No, as a parent,
As a parent,
what do
okay.
you, yes.
Okay, so as a parent, you look at some of the major developmental delays that could present itself. For example, is your child able to dress himself? The child unable to undress? Does the child struggle with brushing? Does the child need to play alone despite the fact that he has siblings? So you check all this for preschoolers. When it comes to primary and secondary, there are some children that behave differently at home and differently in school. So that is why the school system is also a partnership. You really need to be getting a lot of feedback from your child day-to-day activity so that you can be able to know how they are performing in school. Because most times parents don't even engage their children with reading. I know most houses that they have a lesson teacher. So the lesson teacher does everything. The parents don't even know the level at which their children are in terms of reading, comprehension, mathematics, critical thinking, and all that. So truly, if you want to be an intentional parent, you need to be doing their academic work with them. That is the only way you can be able to know if your child is performing at age appropriate or not.
Thank you. Miss Grace, your hand is still raised up. You still want to say something?
Yes, I wanted to say, is it safe to say that you can only tell when the child has gotten to, say, preschool? So a child who is 1 year, 2 years, would you be able to tell if there is an issue, or would you have to wait until the child gets to the age of writing and reading to be able to tell that there is an issue?
Okay, so truly it depends on the condition. In terms of specific learning difficulties, the few things that you can be able to observe at home is to check the child's comprehension level and memory. So for example, let's say you are in the room and you send your child to the bedroom. Go to the bedroom, check under my pillow, pick my phone and bring it for me. The moment the child leaves you and open the door of the bedroom, he forgets what you sent him to do. He will now come back and say, Mommy, what did you say again? You now unconsciously you still repeat the instruction, and then if the child still goes and forget, the next thing you do is to either get up and get it yourself, or if there is another person, you send the person. So this memory issue could be a red flag for dyslexia. Inability to differentiate right from left for primary school children can be a sign of dyslexia. Inability to know the days of the week or months of the year in sequence could also be a memory issue, which is linked to dyslexia. Coming to the preschool level, I earlier mentioned check the check when your baby starts to walk or start to crawl or babbling. So let's say a baby of 6 months has not started babbling. That is a red flag. Let's say the baby is not trying to reach for objects. You know how babies, when you carry them, they want to even remove your earrings and all that. So all these could be red flags, and it could also be a developmental delay. So truly, as a parent, there are only few aspects that you can be able to observe and then get worried. The major part comes from. So if you have a child of 2 years old and the child is not talking, this one you know that you as a parent you tell yourself that something is wrong, you know. So raising a child is a partnership between you, the nannies, the school, because truly sometimes it's not everything that you as a mother will be very intentional about to notice.
All right. Thank you, Miss Indiana.
You're
Miss
welcome.
Miss Chisom, has she answered your question?
Yes, she has. Thank you.
Okay, Miss Fumi, your
Well,
hand was up at one time. We can't hear you.
Can you hear me now? Good evening, Miss Cooking.
Good evening, Miss Fumi.
She actually answered my question
Okay.
partially concerning the
Please
other
increase
than
the volume of your phone.
okay.
The voice
I
is
said
not
she answered my question why
okay.
answering Miss Chisholm.
Okay.
But the other part of it is why talking about this graph here, at what stage can you actually start concluding that a child is graph here?
Okay, at
Can you
least from
conclude
age
if a child should
7.
actually have a rope? Sorry, conclude if a child should have a bowed improper foundation early years. Maybe the child didn't learn how to start reading or putting expressing through writing or constructing sentences early enough.
Okay, so when you look at most of these conditions, there are some children that did not even do preschool. They started school at either what do they call it now, KG1, and then they proceed to year one. So truly, starting school early is not related to intelligence. You understand?
Yeah.
All that the child needs is the kind of environment that he's being exposed to. There are some children that are homeschooled by parents who are not professional. They just know that they can set up a play area for the children and all that. Like when it comes to building fine motor skills, the same skill a child uses in holding the pencil to write is the same skill that the child uses in holding a spoon and dishing food to feed himself. So truly at home, there are a lot that you can be able to do to make the child build these skills. However, whether the child is being exposed to or not, these are skills that are meant to develop naturally. If you look at some of the if you look at the past before education started, I think they were using feathers and ink to write. Nobody taught them how to write.
Hmm.
Uh-huh. So most of these things are inborn. The child is born with the skills. But if a child is not manifesting or making use of these skills, that is when we begin to conduct assessment to check if there is a problem with the brain. Because look at those that write with left hand. It simply means that the left part of the brain was placed in the right aspect, while the right one is on the left. So that is why what you that is a right-handed will ordinarily do with your right hand without anybody prompting you, they will also use their left without anybody prompting them.
Hmm.
So most of these things originate from the brain.
Miss Fumi, has she answered your question?
Very well. Thank you, ma'am.
Thank
You're
you very
welcome.
much. Okay. Wow, we've done an hour 42 minutes already. This
Wow.
is a rich time. Thank you, Mrs. Diana Von. Please follow her on Instagram, Indiana Von Dangaru, and she has lots of things there. Go on YouTube also. She's also there, so that you can watch the videos and understand more. In fact, my as she was talking, I was bringing my children. Okay, okay, my child has done this. My child has done this. Oh, this one. When she was talking about knowing left and right hand, I almost put my head down because that is one of my major problems. If you say where's my right hand, I have to look at my hand literally, even in this my old age. So I know that okay. So I'm in this. I already know that for me now, I'm in this particular group. I am too old. If not, I will say, let me go for a proper um consultation
Assessment.
assessment so that she can assess me. But basically, I don't need an assessment now. But we can do that for our children and then also in the classroom so that you can better advise parents on what to do. Thank you, everyone. It's been a lovely, lovely time. I'm going to make available the video on my YouTube so that it can be accessed at any time. You can access it. You can also, in case you are talking to a parent and they don't want to understand, you can refer them to my YouTube page. Also, I'll put it all across my social media handles. The at least the video for this, the link to this video, so that you can refer parents, other educators also, for all our good. We are all trying to make Nigeria better. Meanwhile, our next seminar is going to be with the Japa teacher himself. If you don't know him, I won't tell you who he is. Our Japa teacher. Um, I'll make available the date. He's going to talk about how you can Japa and teach in UK. He said, me, I don't want to come to UK. I don't know why he said that. But in case you're looking to jackpot to the UK, our jackpot teacher will tell us in our next webinar, will tell us what to do, what not to do, how to do it. It's free of charge. If you don't want to go, tell your friends that want to go, your colleagues that want to leave this country and go and teach in the abroad. Okay. Thank you, everyone, for coming. God bless you all. Let's take note of all we've learned. Use it, use it, use it. It's not too late to start assessing children, even your own children, children in your compound, children in the environment, children in the church, at least so that you can advise whoever you want to advise. All right, thank you all. Let me not take much of your time anymore.
Thank you very much.
Yes, you can end the call. I don't want to end for everyone. Thank you so much. God bless you. Thank you, Miss Rachel. Thank you,
Thank
Miss Grace.
you. Thank
Thank
you
you,
very much, ma'am.
Thank you very much.
Paula.
Thank you, everybody. Bye
Thank you,
bye.
Miss Kumi, for
Bye.
life.
Thank you.
Thank
Bye.
you, Mr. Japa.
Bye.
Thank you, Mr. Yusuf. Thank you, Miss Juliana. Thank you, Mr. Boniface. Thank you, Miss Indiana Vaughn again. Thank you, thank you, thank you. Thank you, Miss Samuel, Miss Victory. God bless you all. Thank you, Miss Stella. God bless you all. And good night.
Thank you. It's your good day.
Say go, sir.